Welcome to this explainer. Today, we're diving into whether you actually need a celiac disease screening, and more importantly, how to make sure you aren't doing it completely wrong. Celiac disease affects about 1% of the global population, yet the testing protocol is so widely misunderstood that it leads to years of unnecessary suffering for a lot of people. Let's fix that right now.
So do you actually need a screening? Well, to figure that out, we first have to understand the battlefield inside your body. Because celiac is definitely not just a simple upset stomach after eating a piece of bread. It's a highly complex, systemic response.
Think of it literally as friendly fire. Your small intestine is actually your biggest immune organ. And in celiac disease, your normal immune tolerance just completely breaks down. When it spots gluten, it sees a massive threat and goes on the attack. But in the chaos of that response, your immune system mistakenly produces antibodies against your own body's protein, specifically an enzyme called tissue transglutaminase. That friendly fire is what actually shreds your intestinal lining over time.
Okay, let's jump right into Section 1. Who needs screening? Identifying risk groups. Medical guidelines generally divide at-risk individuals into a few specific buckets. The first bucket includes those with classic GI symptoms. If you're constantly battling chronic diarrhea, severe abdominal bloating, unexplained weight loss, or even stubborn constipation, your gut is waving a massive red flag. This is the primary, textbook presentation that most doctors are going to look for first. But here is how incredibly sneaky celiac can be. The symptoms often happen completely outside your gut. Because your intestines are damaged by that friendly fire we talked about, you actually stop absorbing nutrients. This severe malabsorption leads to all sorts of extra-intestinal symptoms. Think unexplained iron deficiency anemia, early osteoporosis, chronic fatigue, intense joint pain, and even neurological issues like severe headaches or tingling in your hands and feet. And for the parents out there, please pay close attention to pediatric presentations. Beyond normal childhood stomach aches, really look out for poor growth, falling off the growth curve, delayed puberty, and oddly enough, unusual tooth enamel defects. These can be the very first warning signs of celiac disease in kids, and they absolutely shouldn't be ignored.
Then we have the second bucket. These are high-risk groups who might have zero symptoms right now. If you have a first-degree relative with celiac disease, you are inherently at risk. In fact, medical guidelines highly recommend screening their children by age 3. Your risk also spikes significantly if you have chromosomal conditions like Down syndrome or other autoimmune diseases like type 1 diabetes and Hashimoto's. But get this, here is a fascinating piece of data from the medical literature. Roughly 40% of the general population actually carries the specific genes for celiac disease. Wild, right? Yet only 3 to 5% of those genetically at-risk individuals ever actually develop the condition. It's like genetics load the gun, but something else entirely pulls the trigger. Moving right along to Section 2, the golden rule of testing protocols.
Now, this is the absolute #1 mistake people make when they suspect they have celiac. Do not stop eating gluten before your blood test. The initial screening strictly looks for the specific antibodies your body produces in response to gluten. If you stop eating it, those antibodies simply vanish from your bloodstream. Your test will come back completely negative and it'll be wildly inaccurate.
So if you've already gone gluten-free because you felt terrible, guidelines dictate you must endure a gluten challenge before getting tested. This means going back to a normal diet and actively eating 3 slices of wheat bread every single day for 1 to 3 months before your doctor draws your blood. I know it can be incredibly tough, but it's literally the only way to ensure those antibodies are present. All right, part 3, the 2-part blood test for accurate results. When you finally get your blood drawn, the initial screening must always check for the anti-TTG IgA antibody. This specific test is incredibly sensitive. We're talking picking up the disease more than 95% of the time. But again, only as long as you're actively eating gluten, like we just discussed.
But here is exactly where things go horribly wrong for so many patients. Your doctor must concurrently test your total serum IgA. Why? Because 2 to 3% of celiac patients actually have a genetic IgA deficiency. If you happen to fall into that 3%, that highly accurate test we just talked about is going to give you a false negative. Your celiac will go completely undiagnosed, and the suffering just continues.
And this is exactly why the 2-part test is absolutely vital. Think of it as a failsafe. If your total IgA levels are normal, you can completely trust that primary test. But if you are deficient, your doctor will see that secondary result and immediately know they need to pivot to IgG-based testing to get a true, accurate reading of what's happening inside your body.
To guarantee accurate blood work,
Just memorize this perfect clinical protocol to empower yourself at the clinic. Step 1. Eat the gluten. Step 2. Test the specific anti-TTG IgA. And Step 3. Always verify with a total serum IgA test to rule out a deficiency. Simple as that.
Now remember, while it's highly accurate, blood work is usually just step 1. The blood test proves your immune system is reacting to gluten, sure, but an endoscopy with a biopsy is typically required by major medical guidelines to definitively prove that this immune reaction has actually caused physical, mucosal injury to the lining of your intestines.
Armed with this knowledge, you can now confidently walk into a clinic and ensure your screening is done perfectly.